Hi everybody. Today I'll be talking to you about sonography in first 3 months of pregnancy. When should we do the sonography? What is the significance of doing the sonographies in first 3 months of pregnancy? Is it a must? Yes. First sonography we do when the patient comes. She might come with 5 weeks or 6 weeks of pregnancy. It means she is overdue just by 1 week or 2 weeks. The first sonography, we call it as a dating sonography. It means what period she is telling, and accordingly if I am calculating, is she falling into the same line? Suppose if patient says I'm having a irregular menses and she says I'm overdue by 3 weeks, she may be pregnant by 7 weeks, 5 weeks or 9 weeks. It's very difficult to say. So the first sonography we should be doing as soon as patient comes to us saying she's overdue at least by 1 week, because by 5 weeks, one, we confirm intrauterine pregnancy. Sometimes around 10% of the patient you may have a pregnancy in ectopic site other than the uterus, and it's important that we diagnose it at the earliest. So first sonography when patient is diagnosed. Then between 8 to 10 weeks we always do just the checkup of the cardiac activity. Around 20% of the pregnancies can undergo missed abortions. So what we do is the pregnancy going with the space? It's very important to check the cardiac activity unless patient is very young and we don't suspect, she's conceived naturally and we don't suspect anything otherwise. The most important sonography in a first trimester is done around 12 weeks of pregnancy, and that sonography we call is for the nuchal fold thickness and for the nasal bone. Down syndrome can be, the baby suspicious of Down syndrome can be diagnosed as early as this. How we can do that? It's if the nasal bone has appeared. It means the ossifications of the nasal bone can happen by 12 weeks, and if you can see that, definitely you have ruled out Down syndrome majority of the time. Also, the nuchal fold thickness helps us to rule out any abnormalities into the brain. So it's a must to do the 12-week scan. What we do is we do this 12-week scan along with the double markers, that is beta-hCG and PAP study. Why these markers are important? We ingredient